Let me see. This is the chest. This is the chest. Here to here, how many chun? Four chun. From here to here, nipple. From the nipple to chest is how many chun? Four chun. From here again, two chun lateral. That means you forget about this. So the point is located from here on the suprasternal fossa. That means is the 6 chun away from the suprasternal fossa and 1 to 1.5 chun distal to the distal means below to the clavicle, inferior border of the clavicle. Some authors write 1 chun, some authors write 1.5 chun. So how to remember exactly where this point is located? So the first point itself is a great point to understand this to be known as a mu front point. That means is the front. Mu means is the gathering. Mu means is the connecting. Mu means is the collecting. Mu means is the uniting. That means is the front point to be known as a is the LU-1, that is the Chung Pu. Chung Pu is the pronunciation. That point is located from here. This is the nipple. From the nipple you just come upward direction to the clavicle. From here you come to the clavicle. From here again it is the two chun, 3 fingers lateral. Then this is the clavicle. Below the clavicle you just press it. Once you press it, this area, which area you have the pain if the patient having the lungs related problem. You understand? If the patient is feeling the tenderness is there, pain is there, cough and congestion, dyspnea or any the heart related problem, lungs related problem, you try to find out by giving the pressure. So you just give the pressure vicinity that area. If the patient feel ouch, that means I have the tenderness of that pain. That means you are treating to the sinus meridian. You are treating to the sinus meridian of that pectoralis major muscles. Once the patient is finding the pain here, then you just activate that particular point to treat for the all the pulmonary related disorders, especially when the excessive function of the lungs. Especially when excessive function of the lungs, it causes the more pain. When the deficiency of the lungs energy gets the less pain. But however, the pressure pain is different from the acute pain. When the patient is finding that yes, I do have the unique and peculiar pain, ouch, but these muscles I don't have much pain, I have the pain in this particular point, that indicating that organ having the excess energy gets the more pain and less pain to be known as a deficiency of the energy on that particular organ, which causing the lungs related disorders. Now the pulmonary disorders are numerous. Maybe I cannot tell 10, 20, 30, 40 diseases. You remember when after the medical degree of the MBBS and then wanted to do as a post-graduation, they will focus only for 3 years study only related to the pulmonology to become the pulmonologist. Yes or no? So in that case they will study elaborately about the deeper knowledge about the lungs. But here we understand anything is the lung pathology can be treatable by activating the single point, that point to be known as a Chung Pu. Whether the right lung is affected, activate the right point, left lung is affected, activate the left lung. Make sure that this is a very, very good point. At the same time, it is a very vulnerable point, very dangerous point. It is really, with a disclaimer, you should apply the needle to that particular point. For example, if the pain is there on that time, it's advisable to use only the 0.5 chun to the 0.75 chun is advisable to penetrate that particular point. If you wanted to apply as a 1.5 chun, that is 40 mm needle, you wanted to insert to the deeper level, then you remember that you are connecting and touching to the lungs directly, because you understand all the mu frontal RM points located above the internal organs. Above the, you may ask the question, sir, lungs is located on the chest cavity, thorax. The nipple is located below that, lungs is affected, lungs are located, but still why are you selecting the only one point? Do you know acupuncture points are advisable and treatable by using the high electrical conductivity, low electrical resistance, and also there is a dermatron. Dermatron is some kind of the device. Through that device, the acupuncture points were identified where the high electrical conductivity to be taken place. So that particular meridian point to be known as the acupuncture point. So when you are inserting the needle above the skin surface, then it is totally safe. Once it goes to the deeper level, then certainly which causing the more problem to that internal organ. That's the reason better you just apply surface level of the LU-1 point to treat for all the pulmonary related disorders. So that area, there is no, that area to be known as a pulmonal tantian. That area to be known as a lungs tantian. That not that specific point, not that specific that location, but area to be known as a lungs area. But being a alarm point, the move friend points are treatable for all the acute related diseases. That means all the patient is suffering for the last maximum 1 month. Then you remember, you just activate the point is move friend point. When you go to the further deeper level, remember it is very, very hazardous to the lungs that causes the pneumothorax. Pneumothorax is damaging to the lungs or collapsing to the lungs. Airway is passing inside the lungs, but the lungs get leakage. Due to leakage, the air goes outside the lungs, which causing the more complication. Right? So that's the reason that shouldn't happen, but we just apply the needle on the surface level. Better for the caution type, half tune is advisable. Even for the children, micro level, micro meridian is advisable. Right? 7 mm needle or the 13 mm needle, or you can use the 25 mm needle when the patient is more obese. Like me, then you can use 0.75 tune. That's quite enough, not 1 tune also. Right? Then the second point to be known as a yun men. Yun men. Men means is the gate. Yun means is the cloud. There is a gate is there, that gate to be known as a lungs gate, that just 1 tune superior to the lung 1 point is just inferior to the border of the clavicle. That means where is the clavicle, which is the collarbone. Collarbone to be known as a clavicle. Just distal to the clavicle, all are you touch and feel, which is the collarbone. Touch and feel. Then below, inferior means is below, superior means is above. But above the clavicle, that point is different points. Below the clavicle, the point to be known as a yun men, that is LU-2. Both the points are advisable to treat for the lungs disorders, but more emphasizing way I wanted to tell you, LU-1 is most powerful than the LU-2. Right? So now you understand all the pulmonary related disorders, cough, congestion, dyspnea, and then mucus production, phlegm accumulation, or tuberculosis, anything is the lungs related problem. Certainly you can treat by activating the specific point to be known as a Chungpu, that is LU-1, LU-2 as a supplementary point. Bilaterally you don't know which lung is affected, but the patient understand when the right lung is good, then the right respiration is good. When the left lung is affected, the left respiration is affected. Then likewise you just activate, otherwise you have the dilemma, cough and congestion is there. We don't know from the which lungs is damaging, causing the problem, which bacteria is causing the problem. So that time you just activate both the points is advisable to regulate the lung energy. Then Yun-Men is point I told you just below the clavicle. How many chun lateral? From the suprasternal fossa, how many chun lateral? LU-2 point is located. How many chun? 6 chun lateral. Good. Then 2 points were completed out of 11.